Adalimumab, also known as Hulio, cf. pen 40 mg per 0.8 ml subcutaneous kit, is a medication used to reduce pain and swelling caused by certain types of arthritis and skin disorders. It works by blocking a protein in the body's immune system that causes joint swelling and damage in arthritis, as well as red scaly patches in psoriasis. It belongs to a class of drugs known as TNF blockers. Adalimumab is also used to treat certain bowel conditions, such as Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. It helps to reduce joint damage and preserve joint function. The daily dosage and optimal timing for taking this medication should be determined by your doctor. Before you start using Hulio, cf. pen 40 mg per 0.8 ml subcutaneous kit inflammatory bowel agents, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for guidance. If you are using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject this medication under the skin on the thigh or abdomen as directed, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Make sure to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition persists or worsens, be sure to inform your doctor. Some common side effects at the injection site include redness, itching, pain, or swelling. If these effects persist or worsen, notify your doctor or pharmacist. Remember, your doctor has prescribed this medication because they believe the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you notice signs of infection such as a persistent sore throat, cough, fever, or difficulty breathing. Also, seek medical attention promptly if you experience serious side effects including rapid or irregular heartbeat, new or worsening symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, easy bruising/bleeding, numbness or tingling in limbs, unexplained weakness, difficulty with speaking or vision changes. Rare but serious side effects may include liver damage or a severe allergic reaction. Seek immediate medical help if you notice symptoms such as nausea, loss of appetite, yellowing of the eyes or skin, chest pain, seizures, or a severe allergic reaction with symptoms like rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other unusual effects. And always consult your healthcare provider before taking any medication. So, it's important to be aware that this medication can weaken your body's ability to fight infections, which could lead to serious infections that may be fatal. It's crucial to inform your doctor of any past, recent, or current infections, as well as any history of living or traveling in areas where certain fungal infections are common. Your doctor will also test you for tuberculosis before and during treatment with this drug. Additionally, there is a small risk of developing cancer while using this medication, especially in children, teens, and young adults. It's important to discuss the risks and benefits with your doctor and to notify them if you experience any symptoms that could be related to cancer. Always consult your doctor if you have any concerns or notice any unusual symptoms. Before using Hulio, CF, pen 40 mg per 0.8 ml subcutaneous kit inflammatory bowel agents, it's important to inform your doctor or pharmacist about any allergies you may have, including allergies to Adalimumab or any of its products. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. You should also disclose your medical history to your doctor or pharmacist, especially if you have had recent infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. It's important to note that Adalimumab can increase the risk of infections or worsen current infections, so it's best to avoid contact with anyone who has a contagious illness. It's also important to inform your healthcare professional before receiving any immunizations or vaccinations, and to avoid contact with anyone who has recently received live vaccines. To minimize the risk of injury, it's recommended to use caution with sharp objects and to avoid activities that may result in cuts or bruises, such as contact sports. Before undergoing any surgical procedures, make sure to inform your doctor or dentist about all the medications and products you are using. It's important for older adults to be aware that they may be at greater risk for infections and cancer when using this medication. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor before proceeding. It's important to be aware that Hulio, CF, pen 40 mg per 0.8 ml subcutaneous kit inflammatory bowel agents may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's crucial to keep a record of all the products you use, including prescription, non-prescription, and herbal products, and share this with your doctor and pharmacist. Never change the dosage or stop taking any medications without your doctor's approval. Some products that may interact with Hulio, CF, pen 40 mg per 0.8 ml subcutaneous kit inflammatory bowel agents include other TNF blockers such as etanercept and infliximab, as well as other drugs that weaken the immune system like abatacept and anakinra. This interaction could impact how the medication works and increase the risk of side effects, so it's important to discuss any potential interactions with your healthcare provider. If someone has taken too much Hulio, CF, pen and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important not to share this medication with others. Your doctor may recommend lab and/or medical tests, such as a complete blood count or liver function tests, while you are using this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a dose, it's important to consult with your doctor or pharmacist to establish a new dosing schedule. It's crucial not to take double the dose to make up for the missed one. It is important to store Hulio, CF, pen 40 mg per 0.8 ml subcutaneous kit inflammatory bowel agents in the refrigerator, but do not freeze it. Some brands may also be stored at room temperature, so it's best to ask your pharmacist or check the product package for specific storage instructions. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light, and discard any unused portion of the medication. It's important to keep all medications away from children and pets. When it comes to proper disposal, do not flush medications down the toilet or pour them into a drain unless instructed to do so. It's important to properly discard this product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.